is to determine the quorum. And the quorum is 50% of plus one of everybody that's here, and there's 10 of us. So the quorum would be 5, 6? Six.
Yeah, it would be
Okay.
6.
Well, we have a quorum right now. All right, so we're going to write 6 down here. The first thing I want to do is go around the room, and would each of you introduce yourself and tell us what PSA you're from. So we'll start in that corner.
I'm Patricia Wilson from the city of Los Angeles, and I'm in PSA 21.
Felix Payne from the county of Los Angeles, PS 19.
Gloria Placencia from Placer County, PSA 4.
Bob Petty from Monterey County, PSA 32.
Shirley Crone from Contra Costa County, PSA 7.
Alice Lowe from PSA 17, San Luis Obispo.
Luis Monge, CSL, PSA 23, Chula Vista, California.
Marcia Gould, PSA 25, Los Angeles City, San Fernando Valley.
Ted Kagan, San Diego County, PSA 23.
Thank you. I'm going to introduce what I consider my staff today. First in that corner over there, that's Eric Dye. He is our legislative counsel, and he's to be addressed as deputy counsel. But he is going to make sure we follow the rules, help us the writing up of any of the, re-looking at the proposal, making sure we're looking at it correctly and following any rules. And I'd like to introduce our resource person, Linda Hancock. She's sitting right there in the orange, and she's going to probably be our, how do we want to put it, our catch-all for everything. We're not sure what we need. If we need anything, she's the person to go to. Our messenger, Marcia Hunt. I do that right? And Michael Lacey, who was here, went to get our first person. So thank you for assisting us. I just want to remind the resource manager and the messengers that both the legislative copies and the committee copies of the completed proposals need to be returned to the CSL legislature together, the office, which is room 125. So one of the things that we talked about was what is the appropriate behavior when we have people coming in here. So I'm going to read to you just a little excerpt. And that's everyone, staff, volunteers, are to be treated with respect and also with proper decorum. Any rude or offensive behavior will not be tolerated. And I, as chair, have the right to eject anyone for that behavior. So the next thing I'm going to tell you is we are going to be televised today. So anytime you are speaking or asking a question, please push the microphone till it lights up. And if you want to speak, you can just raise your microphone up, and I will recognize you. Okay, the next thing we need to do is develop a work plan as to how much time we want to allow everyone to talk and to include our discussions. Right now we have 8 proposals that we have to go through today. Let me put this down. And the standard is 2 to 3 minutes for the person to speak. And if you've gone through all our proposals, I think there's like 1 or 2 that's a little bit longer. So I have a recommendation of 10 minutes in my mind because as you get into discussions and the voting and everything, maybe 10 minutes per proposal or more if we need it. So I'd like to hear from each of you or anyone who wants to discuss how much time you think we should put for each proposal as they come and present it. Shirley?
My experience has been that there are some people that speak very concisely and from notes that they've prepared ahead of time to prepare them for making the presentation in front of a committee. There are others that just ramble on and on and on and on and just don't stop. And I'm saying that hopefully we're not being recorded at this point, but I think having a time limit and enforcing it. Do you have a timer?
Linda's going to be our timer.
Okay.
Our resource person.
Okay. And that's also a good reminder for all of us when we have to go and make our presentations to be as concise and to the point.
Thank you, Shirley. Anybody else? So,
Madam Chairman,
yes.
I would acknowledge that too, that we should set a limitation of 10 minutes. And
okay.
In Toastmasters, after 10 minutes, we throw things at the person, so perhaps we can do that.
So can I clarify this then? We want to give the person at least 10 minutes to speak, or the 10 minutes for the whole entire proposal?
I would say.
Okay. Yes, sir.
Since this is my first meeting, I have a question. When they come in, will they be reading exactly the paperwork that we have in front of us?
No.
All the whereases and whereases? And
No.
they're going to be presenting in their own words a summary of the proposal, synopsis, huh?
Right.
Okay.
Well-
Then I would think 10 minutes is more than generous.
Okay.
And we might even, well,
Yeah.
if they're prepared, like Shirley said, they won't need 10 minutes, but I think 10 minutes is plenty if they're not going to be, reading all the words that we have.
Okay. So can I just ask for a consensus, since we don't have to motion for this, right? Or should we put out a motion that we establish 10 minutes as our limit for each proposal?
So moved.
Okay. Anyone second?
Second?
All right. So
No more
Linda,
than
10 minutes for the entire proposal. And I have a habit of interrupting if they're going over, so I will do so. Okay. So now I think we've talked about everything I need to talk about. Is there anything else I need to add to the beginning while we're waiting for the person to come? On the very first, I think, Linda, are we going by order of the proposed numbers?
We have sent out messages to the first two presenters.
Okay.
Hopefully they'll be here soon.
Officially, you need to do a roll
Oh, I'm sorry. I left that out. Yeah. Yes.
For efficiency, I noticed that Senior Assembly Member Dahlgren is associated with two of the proposals. So can we assume that when he comes, he'll do both of them regardless
Or
of
we
what
can
order?
ask him.
Yeah, I
Yeah,
think
I
that would
think
be
it
an
makes
efficient way.
Thank you.
And they're very related to each other anyway.
I couldn't find the difference in them, so.
I think one is,
One's for the federal.
one's for 1 year and one is for ongoing.
I did
believe
forget
that's the
for
difference.
roll call, Linda, would you, I'm sorry, I forgot. We're going to do roll call.
Okay, Assemblymember Tom,
Here.
Assemblymember Lowe,
Present?
Assemblymember Day, Assemblymember Gould,
Present.
Assemblymember Kagan. Here. Assemblymember Crum.
Here.
Assemblymember Monte.
Present.
Assemblymember Payne. Present. Assemblymember Teddy. Here. Assemblymember Placencia. I'm sorry, how do you pronounce? Placencia. Placencia? Yes. Assemblymember Polk. Assemblymember Taylor. Assemblymember Wick. And Assemblymember Wilson. Here.
Thank you. Thank you. I thought one of the things while we're waiting that we may want to just talk about was, and I thought this was very important when I was reading it, was that how we should look at each of the proposals. I'm sure all of you've read this, but I was thinking maybe we should just go through it just to see as much as I understand this is every proposal should be looked at how clear it's written, how clear they explain it. How or what they are presenting can support the seniors. Some of it's going to have urgencies to it, and I think we need to look at that. We definitely need to look at anything that costs a lot of money, because they're not going to pass it. We've already been told that. We need to look at what some of the senior and the public support would be for some of these proposals. And how much research did these people do to come up with those proposals is not the most critical factor, but it's an important factor, I think, to see what brought these up. Oh, Lauren's here. Okay. And then look at what's the best one to select for the legislating. So I see we have our first. Oh, yes, sir.
A operational question. Since we meet tomorrow afternoon as well, is tomorrow just we pick up where we leave off today, or is today listening to proposals and tomorrow decision-making on our part? How are the 2 afternoons?
Usually, the first day,
Agendized.
what I remember is that we try to get through all the proposals today and we vote on it. Tomorrow will be where the Senate group, see, we're the assembly, so the Senate group has their social, and they will pass on the things they've voted on today that have passed, and we would review those.
Thank you.
But if we don't finish, usually we finish. So, all right, we have our first guest today, and this is, let me make sure I got this one right. Yeah. I will let you know in 1 second. This is number 2?
On page 103.
Number 1.
Page 103. Okay, and it is Assembly Proposal number 2. And this is Senior Assembly Member Roth.
Yes.
And the proposal is to authorize use of IHSS providers in declared disaster shelters to assist seniors and people with disabilities.
Hi, thank you. This essentially has to do with declared federal or declared state disasters. We all know that in California we have had a large number of fires and other kinds of disasters, earthquakes. Who knows? We could be looking at a tsunami one of these days. But the fact is, we need to be prepared to be able to adequately shelter people. Currently, a regular disaster shelter works just fine. I mean, and California is getting very good at it. The Office of Emergency Services and the coordination is getting better and better, probably because we have so many of the fires that they have to deal with and large-scale evacuations, except when we need to take care of frail seniors. Evacuation of frail seniors to a regular shelter, they are not equipped to be able to use the resources there. Sometimes it's just small little things that traditional shelter doesn't have the staffing, it doesn't have even the understanding to help frail seniors to be able to use the resources and to make their way out of the shelter. So what this proposal does is it proposes to use in-home supportive services workers to come to the shelter and to assist seniors and people with disabilities probably as well, but primarily seniors, so that they can utilize the services without having to be evacuated to a special needs shelter, which more cases than not has more medical services than is needed. And we all know that, as we get older, seniors get older and older, small things help them to be able to utilize or stay in their homes. In the same way, small things, small little assists would help them to be able to utilize a shelter. With just a little bit of knowledgeable help, they could access food. They could get some assistance in making the bathrooms more usable for them, bathing, maybe a little bit of help in dressing, even the food. It might not be prepared in a way that they can chew it. With a little bit of help, somebody could help them to do this. And IHSS workers are they're trained. They've already been vetted. They've been screened. After the lawsuits, they could very well have already been fingerprinted. So you have a ready source of people who could be readily and easily deployed to the shelters to help. Of course, in these days, we're all thinking about costs. How much is this going to cost? Well, in my county, the wage for IHSS workers is $11.50, and that is the highest except for two other counties. And with that $11.50 for 10 hours a week, it would be $140 to assist a senior, to help them help them if they needed help reading materials, if they needed help listening to instructions, sometimes even to transport them to other sources of relief, like FEMA or the social services of the county, to get the kinds of relief that they need, and to move them into safe and secure long-term housing. The principle is familiar to all of us, that only a little bit of help will help the seniors to be more safe in the shelter and to move them their way into independence again. So that's what I'm proposing. Any questions?
Giannone, working the fires in San Diego for the last couple of years, I know the importance of that. But when you're saying the cost, are you applying the cost on the county-wide or the statewide?
This is just per individual. So the cost would be, if you authorized 10 hours a week to help this person utilize an existing shelter, it would cost approximately $140, depending upon the taxes and I use Solano County's percentages just because I happen to have them, and that's about an 18% tax, fees, workers' compensation. So the cost also of wages. In each county, IHSS workers are paid something different, and you would use the existing structure, their wages, and the payroll system. And then this could be reimbursed through disaster funds.
Thank you.
Thank you. Just a few points for clarification. One, you're talking about shelter. So the shelter not necessarily under county's jurisdiction. Am I right? It could be in the city, each individual
Yes,
city.
each entity,
Okay.
if it's a city, they will declare, they will open a shelter if it's within their range.
Yeah.
If it's outside of any city, then it would be a county's responsibility. 9 times out of 10, it's going to be American Red Cross that helps whichever entity open a shelter.
Okay, so each shelter probably will be handled there financially would be different. And then my follow-up question is, you mentioned about 10 hours. Is there any particular reason behind it? Has to be 10 hours?
No particular reason, except that I just thought that if we put some kind of limit on that, there should be some sort of limit. Now, whether it's 10 hours or whether it's less or whether it's more, there should be some sort of limit. Otherwise, it can snowball into a really, really costly thing. Yeah. I think that's probably up for debate, how much it would be. I would really like to have a discussion with some of the social workers who do authorization to determine what they think would be the right number.
Yeah, because right now you say each person needs 10 hours. Mm-hmm. So that's...
Potentially, up to.
Thank you.
Mm-hmm.
Are we talking about 10 hours during the time of the disaster or on a regular basis?
Now, this would be while they are in a shelter, and it would be to allow them to more easily use the services of a regular shelter rather than having to be evacuated to a special needs shelter, which 9 times out of 10 is a hospital.
So then it would be in a situation when there was a declared emergency.
Yes.
That would be a big difference, because that was also under the understanding possibly that it could be on an ongoing basis where you will be training, or whoever's going to be training these folks during these 10 hours allocated, but this is necessary during an emergency situation only.
Right. And I, with regard to training, I think what I'm suggesting is that we capitalize on the training that the IHSS workers already have.
That makes sense. Thank you.
The evacuated seniors and disabled persons with minimal medical needs whom the IHSS workers would be helping, are these individuals who have already been receiving IHSS services in their homes, from which they have been evacuated and transferred to emergency shelters because of the emergency? Or are these people that aren't already in the program?
I included everyone who would have a need, and that's why you see the mention of the social workers. Those who already have IHSS hours, that they can't have their IHSS workers work for them in the shelter because it's not their home. And that, so this would take care of both of those situations.
Well, that's why I was wondering if you're including as the recipients of this help people who are not already receiving IHSS services, then what happens, and you pull an IHSS worker in to help at the shelter, what happens to the clients that person has been helping in their homes? I mean, they can't be at the homes here and the shelter there.
Yeah, I hear what you're saying.
Okay.
I used to be an executive director of public authority, and what we learned from people in the San Diego fires and in the San Bernardino fires is that they had ready lists of IHSS workers who either only had one or two people who were they were assigned to, they were working for, or didn't have anybody, but they were on the list, the registry list, and they were available and willing to help out.
So it would be correct to say that this would happen only if, A, there were IHSS workers with extra time on their hands to work. In other words, we're not going to be neglecting current IHSS clients to help people in shelter. So, and if there weren't, then they would stay at the homes of the people whom they're already helping. They wouldn't be pulled away from the homes to come to the shelters.
No, they wouldn't be pulled away from the homes. In
Right.
many cases, though, what we also found was there was no home for, the senior was removed from the home, but they were not allowed to help them because it wasn't a home.
I'm just thinking of counties where there is not a surplus of IHSS workers or ones that have extra time on their
I hate to
hands.
interrupt, we're out of time, so that's okay. No, we're first time, so for us. Is there any other discussions about this topic at all? We got, I'll give
Yes.
you a minute.
I would like the 10 hours. It bothers me that you have up to 10 hours, because in the fire situation, there were 3 days when the people were in shelters. So I take issue with the up to 10 hours.
And certainly, that's something that it was not quite arbitrary, but it certainly could be changed. And like I said to someone else, I think that we would talk to social workers to find out what might be the right number of hours.
Yes.
Just one question. Oh, hello. My question is, and I see something here about the employees, what part will they be paying in this? Will they have a partial payment in providing these shelters?
Okay, I'm not understanding. You're talking about the actual workers?
Yes.
The
Yes,
workers would
yes.
the workers would get their regular per hour payment, and it would take advantage of the existing payroll system that's set up in the county, between the county and the state. And then reimbursement for those costs could be taken from disaster funds, could be requested.
But not having anything to do with the shelter itself, helping to provide the shelter for the disabled.
No, the idea is to help that disabled individual or that senior access what is being provided.
Thank you. Thank you.
Okay. Will someone make a proposal a motion to accept this proposal? Motion. Second? Okay, great. So now we're going to vote. Can't leave yet. Linda?
Motion is being passed. Assemblymember Tom,
Yes.
Assemblymember Lowe,
Yes.
Assemblymember Day.
Not here.
Okay, Assemblymember Ginsburg. Assemblymember Gould.
Yes.
Assemblymember Kagan.
Yes.
Assemblymember Crone.
Yes.
Assemblymember Monke.
Yes.
Assemblymember Payne.
Yes.
Assemblymember Petty.
Yes.
Assemblymember Placencia,
Yes.
Assemblymember Pope, Assemblymember Taylor, Assemblymember Week, Assemblymember Wilson.
Yes.
Okay.
Thank you
Senior
very much.
Assembly Member, she and I are friends, I'm sorry.
Thank you.
Your proposal has passed the committee, and the proposal has passed with 10 votes, positive, or yes votes, and it will now go forth to what do they call that? I forgot.
Consent item.
Consent. Thank you so much.
Okay, thank you.
Thank you.
Thank you for helping, guys. 6 of them. Yeah. Okay, we're ready for, is this number? Dahlgren? Okay. Senior Assembly Dahlgren, you're here?
Yes.
Yes, sir.
I need to maybe have something clarified. When we said 10 minutes, I thought that was for the proposer's presentation, and it didn't include our questions time.
Well, we were trying to include everything, so.
Well, that's why I want to clarify. I thought it was they got 10 minutes and then we asked questions.
Yeah, well,
Oh, so I
I'm sorry.
apologize. Yeah.
I apologize, should have clarified it more, so. Welcome.
Thank you.
So bear with me, and this is my first time, so. This is proposal number 1, and are you going to talk about number 10 also?
Yes, I'd like to include number 10 at the same
Thank
time so I
you.
could save myself
So this
another
will be
walk.
number, Senator, it will be, was it AP 1 and AFP 10?
Right.
And the proposal is Senior Center Month.
Yes, and the only difference in the two proposals is when I,
Can we turn the
Okay, it's
you want the page
page
numbers?
99
99?
and page
135.
135. And before you start, one of the things I didn't do on the very first proposal was to ask someone to make a motion to approve hearing the proposal. I was just looking at my notes, so will someone do that?
Yes,
Just to approve hearing the proposal.
Both of them?
yeah, both of them.
Okay. Yes.
Make that motion.
Second?
Second.
I'll say it's been moved and second. We're going to hear the proposal. Proceed, please.
Okay, my name is Richard Dahlgren, PSA 31, and the only difference between these two proposals, when I reviewed them with the state legislative office, they informed me that proclaiming a month at the state has to be done annually, and if you'll notice, the federal proposal doesn't have any statement for the year 2010, so if that one's approved, it'll be every month will be, every February would be Senior Center Month with the federal government. And the reason I wrote this proposal was, number one, having attended the Senior Center Forum and hearing all the information that was presented there, it became even more clear to me the need for senior centers, both statewide and nationally. And back in 1979, 1980, I was a newly hired director of Parks and Recreation for the city of Los Banos, and one of the first tasks I had was to write a Senior Center Bond Act grant at that time for a senior center in our community. And what we were doing, the city council had decided to tear down a beautiful old building in the heart of downtown. And so what our Park and Recreation Commission was able to do was to convince them if we could get some funding through this new Senior Center Bond Act that was 30 years ago, we could save that building and convert it into a senior center. And as luck would have it, that building was built right after the San Francisco earthquakes, and the architects were from San Francisco, and the walls were 2 feet thick reinforced concrete. It would have cost them more to tear down that building than would it cost us to rehabilitate it with the Senior Center Bond Act. So I felt it's just critical for the future to keep senior centers on the forefront in the minds of the state legislatures and also the federal legislators, so that they'll never forget the value and the need for senior centers. And of course, the other thing that was entering my mind, and this, I would rather be proposing a bond act to build senior centers, but I realize that's down the road. So the next best thing, I think, right at this time is to keep senior centers in the foreground, and I think a good way to do it is by proclaiming 1 month each year to be Senior Center Month, and then working with all the senior centers throughout the state and the nation to promote their programs and services during that month and get advertisement and keep it going. So, and this was a proposal that obviously really doesn't cost too much money. So I'd be happy to answer any questions. I think it's pretty simple in my mind, and I'm really excited about it.
Okay, sure.
I support this proposal a lot, actually, because I think it's also an opportunity, as you said, to promote senior centers. There's a lot of people that don't utilize those services or go to those programs and could really benefit by it. But I think, with a proper promotion and public relations, advertising what happens at these senior centers, you can get a lot more people interested, and that it would ultimately improve their quality of life, I think.
I concur. I support it totally because I spent 12 years as an activity director for the city of Inglewood with seniors, and I know how vital these places are for seniors because basically on the weekends it's like a home away from home for them. So I support it 100%.
Thank you.
Anybody else? Yes, ma'am.
Very good proposal. My question is, you said that the state has to vote on this every year.
Yeah, I kind of was taken aback by that when I was talking to the legislator. He says, you do realize you'll have to make this proposal every year because with the term limits, they don't want to bind over somebody in the future. I didn't realize that at the time. And maybe that's another issue that could be addressed.
Okay. Thank you very much.
You're welcome.
Alice.
Hi, Senator Dahlgren. How are you?
Fine.
Good. Yeah, I'm glad that our governor signed February as the Senior Center Month. But I'm really excited from your proposal. You mentioned about new vision for Senior Center. Can you elaborate a little bit more? I really like the idea, and I would like to hear a little bit more in terms of new vision.
What's been going through my mind, and listening to Lynn Doucher talk today about the future, I realize that what really is going to benefit senior centers, not only the programming, but the facilities. In our case, our grant is 30 years old now, so probably need a new roof and new plumbing and a lot of upgrades to that senior center. So if you have a vision, funds in the future are going to be needed, but to keep the services and the planning that's going on in all these centers at the forefront by having a senior center month every year, that will help us for the future. And the other thing that I think that could be done when this, I just refer to it as a bond act because it was a 1980 Senior Center Bond Act. I'd like to see when that bond act is finally developed, maybe there's some ways to tie some other community financing to that bond act, such as redevelopment area funding sources, even other taxes from the community to leverage those funds for those community and senior centers. So that's kind of what I'm thinking about in the future.
So your new vision, it's related with the financial support, how to maintain the existing senior center buildings.
Not only how to maintain them, but how to improve them.
Yeah, improve the building. But
right.
Okay. Thank you.
Okay.
You're next.
Thank you, Senator, for showing up and giving us your proposal. The one thing that I was going to ask, you mentioned the state is a yearly thing, which we understand. What do you anticipate getting these through in the federal level? Is it cumbersome, you think?
Well, what
do you anticipate?
we're kind of a small county, and so what I've already done in our case is Dennis Cardoza is our congressman, and I'm getting to know his staff pretty well, so I've already told him I had an idea for something that he could propose on a federal level. It's not going to cost any money, but it's going to really benefit the seniors in the long run, and they were really receptive to my thoughts and everything, so I fully expect to approach his office once we see where the proposal goes here.
Well, being that it's just going to be a day that will be celebrated for senior season, I don't think that there would be any financial or cumbersome financial need necessarily to make it through, other than to say that maybe there would be some resistance from some of the other side people saying that this is the start of a new, you know what I'm talking about, new bureaucracy or whatever, but this is not going to create a bureaucracy. It's just going to be a celebration of a senior day, and being that the senior population is increasing tremendously, I think that it would be a great thing to have for promotional type of thing nationwide.
Yeah, what I think it would really do is motivate the senior centers themselves to, hey, February is going to be Senior Center Month. We're going to think about it now. We got 6 months to plan some special activities and really air out what we do in the community during that month every year. So I think it's really going to be a great thing from that standpoint.
Assemblymember Petty.
Yeah, I really like the first proposal because unless there are other states who have passed a similar one, that would make California the first one to officially, with the governor's stroke of his pen, acknowledge a month as Senior Center Month. And, of course, I like number 10 because although it'll probably take longer to pass and become law, simply because it's federal, once it does, then I don't see any reason for us to worry about redoing the California one every single year, because it'll be a national month of recognition, and it would simply be up to, say, the Department of Aging to work with AAAs and have special activities during the month that is a federal recognition of senior centers. So I like them both for those couple reasons.
Okay. I want to throw my vote in also because I've been working with senior centers in my county, and they feel neglected a lot of times. They're not recognized. I mean, the seniors are recognized, but their center are not recognized. And I think this is a tremendous way to bring them into the rest of the other things that we do for seniors, because the centers are important to them. All right, any further discussions? May I have a motion to approve it? Oh,
I move that we accept proposition,
We need to do
1 and 10.
okay. Second?
I'll second that.
All right. Can we have the vote, please? Yes. Oh, well, let's do a yes and no. I think pretty much it'll be easy to do, right? And can we do both? I'm just out of curiosity. Can we vote for both now, or should we just
I think it
vote
would be better to keep them separate.
separate? Okay, let's do the first one, the AP one.
Assemblymember Tom,
Yes.
Assemblymember Lowe,
Yes.
Assemblymember Day, Assemblymember Ginsburg, Assemblymember Gould,
Yes.
Assemblymember Kagan,
Yes.
Assemblymember Crone,
Yes.
Assemblymember Walke,
Yes.
Assemblymember Payne,
Yes.
Assemblymember Petty,
Yes.
Assemblymember Placencia,
Yes.
Assemblymember Polk, Assemblymember Taylor, Assemblymember Week, and Assemblymember Wilson.
Yes.
Okay, that's
Great.
5.
Okay. Oh, yeah, we're going to do the second one, right?
On AFP
Okay.
10, Assemblymember Tom,
Yes.
Assemblymember Lowe,
No.
no. Assemblymember Day, Assemblymember Ginsburg, Assemblymember Gould,
Yes.
Assemblymember Kagan,
Yes.
Assemblymember Crone,
Yes.
Assemblymember Monke,
Yes.
Assemblymember Payne,
Yes.
Assemblymember Petty,
Yes.
Assemblymember Placencia,
Yes.
Assemblymember Polk, Assemblymember Taylor, Assemblymember Week, Assemblymember Wilson.
Yes.
All right.
Okay, that's
Senior Assemblymember Dahlgren, your proposal, AP1, has passed with all 10 votes, and it will be forwarded to the, what do they call that thing? Consent. Okay. On AFP 10, the vote was 9 for yes, 1 no, and that will also pass with the one dissenting votes. So thank you very much.
Okay, thank you.
Thank you.
Madam Chair, we are still waiting on another presenter. You want to take a break for a minute?
May I make a suggestion that we inform the speaker that we have a 10-minute limit so that they can adjust their talk? Well, we might have to go to the bathroom or something.
You're right.
I wonder why Lowe didn't vote for it.
Eric died.
Miss Lowe.
Nice to meet you as well.
The one that's walking right there. She voted no on it. On the
Yeah, with the legislative council. Yeah, no, it's good to be here. This is a lot. Yes. Yes, I'm one of the attorneys. Although the one I drafted is being heard in another committee. But yeah. It's there. It's there. That's right. Yeah, thank you. Thank you for having me.
You're doing terrific.
Proposal, then every state, doesn't every state do it? Well, it would push it from that point to every state. I mean, I would love to see people on the ballot. Let's say that Congressman Smith accepts it as a state proposal, we could just do it every year. Why would it have to be put through again through the senior legislature? If it's something. They don't do that in every state. The way I understood it was every state has its own whatever. Right. So even things that this state, this year, unless it's something federal, they won't go on it. I don't know the reason behind it. But I just meant as far as the state's concerned, if, let's say our state. Well, if it was federally signed, it would go on to the. Yeah, but if it's our state person, why would we have to rewrite it in the senior legislature every year? Wouldn't the person? Maybe we need to just prod them every year. Yeah, I think, I don't think we have to write it. I remember last year they had what is that, May that Joanna's, and then she put it in again. I said, why am I seeing the same proposal? Right? And then there's another one this year that's coming 3 times. So.
I mean, like May is Older Americans Month.
Right.
So we don't have to have a state Older Americans Month.
Right.
We just create activities through the Department of Aging and AAAs that deal with older Americans every day.
On a local level, though.
Yeah. But it's under it's always the same month as the federal Older
Yeah.
Americans.
We have an amazing senior center in the San Fernando Valley. It's called One Generation. I don't know if you've ever heard of it. One Generation.
It's a very good set.
And one of the things they do, which I found fascinating, is they match older adults that come in for daycare with preschool kids. And the kids have a grandfather, grandmother figure, and the older adults just open up. They're just so excited to have these little children. It's a nationally recognized program. It's absolutely amazing. And I've been there to watch it. It's terrific. Yeah, but I've been going around and visiting senior centers, hang out with some of the comments, and I do all the outreach programs for them. And it's really interesting when you go into one that's really well organized. They just closed one of ours. issue that was passed years ago, and that money's just sitting there. Nobody's using it. We've never had this happen. We need to have two people called at once. Well, they did. The other people are getting theirs. Oh, got it. This last one was waited, actually waited almost half an hour. Really? And it was like, so that's why we should take it. We're doing great. I don't know, but I keep getting these, you're impressive in your work. You keep a lot of real. I have no idea, that's why I said, I didn't even look at this until, it came to, anyway, where's my meeting? Sally was as well. She would be chair. I would do, well, can't count on anything here. No, they do that. They do that. But tomorrow, we're going to be looking for, we're going to be nominating the names into there, too. I think every committee's going to be nominated. And the ledge committee. Oh, for one assembly ledge committee. Right, so it's one for both, one for theirs and one for. Is it one or two? I thought it was two people. I'll double check tonight. I thought it was two for each. Two from each group.
Yes.
Two for
think so.
chairs. All I know is the ledge assembly is picking. And I thought you picked two people. Is that, I can't remember. I'll ask Laura.
Yeah, I don't know. I don't know all your parliamentary rules. Sorry.
Do an alternative, alternate member?
That's what I thought here we picked two for like ledge. And then,
And two for GRC.
yeah, I think, if I can remember correctly, that we're going to pick two people for the ledge committee. And then they both get to speak at the assembly. And, no, am I wrong? Well, when I went, well, no, I wasn't. There was no opportunity last year and the year before for the candidates to speak. And they just kind of went through it last year, I wasn't here, so I don't know. That's what I thought, two for each, and then everybody gets to speak, or they did the last time I was here.
Yes. About what in particular? Myself?
Yeah, can you give us while we're waiting, can you just tell us
Sure.
how many years you've been
Well, this is my second year doing California State Legislature, and going into my third year at the Office of Legislative Counsel. And yeah, I mean, I'm definitely here to help with some of the legal questions that might come up with respect to the content of the proposals. I don't know all of your parliamentary rules quite as well. That's something we kind of leave to the clerk and the chair a little bit more. I think you've got better materials in front of you than I do with respect to parliamentary rules. But so, well, some of the stuff is just I recognize that from last year. And I mean, the way it seems like you guys run committees are pretty similar to the way the regular legislature runs them, but there are a few differences. So.
just to have people, we're going to go to that, wait, now walk back with me. Good luck.
as long as you have a quorum. Yeah, you can't take a vote without a quorum, but otherwise you can keep going. Yeah. It's yeah, because yeah. No, well, my notes say that the number of people you use to determine what the quorum should be are the number of people who are present on the first day, and there were 10 of you present here on the first day, so it's 50% plus 1, so we're using 6. Yeah. It's whoever's here on the first day. That's what my notes tell me are the rules. 10 people, but a quorum is 50% of that plus 1, so that'd be 6 people for a quorum. Yeah, the quorum. No. A quorum is 50% plus 1 of the committee members, and the quorum is established. But my notes say that the quorum here on the first day, let's see. The number of so my notes tell me that the number of members on the committee on the first day will determine the number from which the quorum is established. So the number of members here today were 10. So, I mean, there's supposed to be 15 on the committee, but I believe this is how we did it last year, too. Not everybody shows, not everybody can come, yeah.
We've asked 2 others to come. I was missing a sheet to send for others, and this is what Mike just brought me.
Well, they're all the same person, Sarah.
Oh, yeah.
Maybe there's 2 different Taylors.
I looked for him, but he wasn't there in the, I went by there, but he wasn't there.
Possibly because they changed the rules.
You must be kidding. Oh, you're talking about these elections? I thought we were... I thought that was a 4-year... Wasn't it 4 years? Oh, that's right. May it'll be for the following year. You're right. Oh, my. I have to wait till I get my 10-year thing. I can't go yet.
Sayonara.
I need another certificate. Was it a plaque they gave yesterday, or was it just certificate?
I think it's just the pin they gave them.
Oh.
One of these.
I want mine in gold if I'm here 10 years. How long have you been here, Alice?
6 years. 5 years.
This is my 8th year.
Won't be long.
Wasn't number 3 up last year also? It's been before.
Does something just fly in?
Blue in my eye?
right down to the,
You want to wait for Marshall and...
Here I am. We went to the wrong room.
This is on?
Yeah.
Okay.
What number are we on here? Number 9. Okay. What page is that? I'm sorry. Okay, we're going to be on page 111. This is proposal 9. Hang on a second here. Excuse me while I look it up. And this is Senior Assembly Member Solma.
Margaret Solma.
How are you? And the proposal is physical education programs for older adults. Oh, yes. Yeah. Oh, before we do get started, I need a motion to accept listening to the proposal.
I shall do move. Second.
All right, thank you. Push the button, because we're on camera,
Okay.
and also you have, we have your proposal for 10 minutes,
All right.
okay?
I'm not a long speaker anyway. I speak from experience because I've been hit by a car twice. But I'm speaking not only for myself, for a lot of seniors who have had physical ailments, whether induced by an accident or for other reasons. Mine was by a car hitting me. And as a result, when I was starting to feel better, the doctor said you should go to therapy, physical therapy. And I went to this physical class. Now, I've been hit twice, as I say. So one accident happened quite a few number of years ago. And at that time, the physical classes were free of charge. We never had to pay for anything. And then later on, there was a charge every semester. And these classes are very important. I'm not only talking about money. These classes are for people who had some kind of ailments or body troubles with their bones. And the teacher is an excellent teacher. She gives you exercises. She understands all the things, especially for elder people. The exercises to do to improve yourself so you don't end up in the hospital again. It's and to avoid pain. So all of you who have gone through different things understand what I'm talking about and why it's so important for these classes. It's not just a pastime. We're going there to help ourselves to improve, to get better. And then when the budget crisis came last summer, the classes were discontinued for the whole summer, even though we were paying for them. And they started them in September at double the cost. But the thing is, I'm here because we had a meeting why the classes were being canceled out. And the principal who spoke to us said he got word from the governor to cut the costs 1/3. And where are they going to cut them? They cut them up on the seniors. They figured they're not important. And I think they are important. They've done their work, and they've helped a lot of people, and they shouldn't be left to suffer at the end of their lives. So that's the purpose of this. Is there any questions?
Alice, go ahead.
Yeah, I would support this proposal. I think it's very important. But in my city and county, we are lucky that we still have this kind of a classes and wasn't cut. But if some other places are cut, I think should be restored. They shouldn't cut.
They took those funds and used them for other things, and that's what I'm aiming at, that they shouldn't be cut and used for something else. They are very important.
Right.
She's next.
I think this is a wonderful idea. However, with the budget cuts and having worked in adult education and regular education in LAUSD, I do not see that this can be passed this year. They're just not going to make this an important, it's just not this
But
year.
they are paying part of the cost. It's not that they're not paying anything at all.
Right, but you have to pay for part of this now. I mean, more than you did when you just enrolled in the
They
class.
doubled the cost, but that's not it. I'm not talking about how much we're paying. I'm paying that they shouldn't cut them out again because we had to go the whole summer without any of this, and that doesn't improve your situation
Right.
at all.
I'm just trying to be realistic. I don't see that at this point we're going to, California Education is going to do that.
Are there any options other than this particular system that exists, such as the YMCAs and providers of health care that have these programs that are, available?
They have exercise programs, but they're not really geared for seniors and the problems that seniors have.
Well, the reason I say that is because my son is a therapist in the knee replacement and hip replacement clinic, and he was telling me that Social Security was doing a lot of these several services. And don't get me wrong, I don't know who paid for these things, but they were available. And
Well-
I don't know whether this is still the case or not, but maybe there's an option out there that we might want to consider.
Well, the word came down at the end of the last year, and we had a lot of the seniors come in to speak about people who had to have a knee replacement, and they had both knees that were out, and after the first one was operated on, they exercised and it helped them. They didn't have to go in for the second replacement. You see, so these exercises do help.
Well, you know,
That's the purpose of the
like I say,
proposal.
I know for a fact several friends of mine that had these replacements, and in a very short period of time, you know, they wish they had done it 10 years earlier, because they are very effective.
Yeah.
And I understand what you're going through. Thank you.
Yes, there are a lot of programs I'm not for sure if you're aware. It's called Be Well program through Kaiser, and they hold these programs at different parks and recreation centers for situations like this, because with seniors with knee replacement, hip replacement, and things like that, and it's free. So I don't know whether that would be a situation
this
that...
is such a program. This is such a program. And it's held at senior center.
Right.
But the teacher has to be paid, and they cut the classes, and she was really worried that she wouldn't have a job, so a lot of her classes were cut off.
There's a big difference between terminating and reducing a program, and whenever there's a reduction in state funding, I think everybody at every level in every program should pitch in and cut back a little bit, all for one kind of thing. So this proposal wouldn't prohibit the state from reducing the funding and thereby reducing the number of senior physical education activities. It would prohibit the state from terminating, which to me operationalizes as cutting out altogether. So I would be in favor of this proposal, knowing that it's not going to keep the state from cutting back on funding for senior PE programs. And I think if we were prohibiting any cutbacks at all, then there wouldn't be a snowball's chance that it would get passed. But this way, I think it's maybe just a way of reaffirming that seniors are willing to do their share in cutting back, but don't cut it out altogether.
They're paying twice as much as before, so that shows you they're willing to keep the classes going. But we don't know for how long. We know we're just going to be going from now till June, from September to June, although we were out for a number of months. So we don't know. We're trying to keep this going for the future. That's the purpose of the proposal.
Yeah, I think her proposal is saying that right now the funding to the school for education purposes, including for adults exercise classes as an education program, is going to be cut. And so I was with Robert, right, Bob? Yeah, Bob. Yes, at this kind of lean years, we all have to tighten up our belts, but should not be entirely
And
totally
not to
cut.
eliminate it altogether.
That's right.
Yeah,
So I think that's the difference.
Yeah.
The money is there, but the school
they're using it for
didn't
other
cut
things.
from other places, but just cut the seniors' exercises classes off. So that was the proposal.
That's the purpose of it. You've got it right. Yeah.
Would you consider an amendment to your proposal that it would include the school districts and other, rec and parks or park and rec programs, because they also have physical education programs? But you've limited this to the school district, and I think that's...
Yes, that should be included, because this teacher does go to various areas. She doesn't only go to this one area. She moves around different days to different places, and they're all seniors. And we know that the budget is in a lot of trouble, but the seniors are taking the biggest hits on this budget in all areas.
So we have a proposal for an amendment Well, I propose that you insert and our Park and Rec and other social service programs.
Yes, okay, I'm willing to include that.
Go ahead.
I agree with the intent of that, but I think that that's a big problem because it'll change the whole proposal because the proposal is based on the funding from the state school fund. And my guess is that programs offered through Parks and Rec don't come from the state school fund. They come through a different revenue source of the state budget. So then we'd have to be also amending this to include restriction on or funding from other state funding streams as well. And maybe this could just be a start. And another bill would be a similar one, but focusing on Park and Rec funds as opposed to
That's why it was written up the way it was.
state school fund.
Okay.
Yeah.
So I agree with the intent, but I think maybe it shouldn't be an amendment to this.
Okay, I withdraw my amendment proposal.
Okay.
That's why it was written up the way it is. Yeah.
All right. Can I have a motion to accept this proposal?
I move to accept the proposal.
I second it.
All right. Time for a vote?
AP9, Assemblymember Brown,
Yes.
Assemblymember Lowe,
Yes?
Assemblymember Day, Assemblymember Ginsburg, Assemblymember Gould,
Yes.
Assemblymember Hagan,
Yes.
Assemblymember Crone, Assemblymember Monke,
Yes.
Assemblymember Payne,
Yes.
Assemblymember Placencia, Petty, excuse me, Assemblymember Petty,
Yes.
Assemblymember Placencia, yes. Assemblymember Pope, Assemblymember Taylor, Assemblymember Wig, and Assemblymember Wilson.
Yes.
Thank you all.
Thank you. Yeah, I'm finished. All right, it's passed.
Madam Chair, can I speak?
Yes.
Over here.
Oh, I'm sorry.
So we're going to hold the rolls open until the end of today's meeting for our one absent member to vote. Is that correct? We normally do, because, I mean, we have a quorum, so we were able to take the vote, but we
Okay.
normally try to keep the rolls open so that our absent member can vote. But just to clarify.
Okay.
Yeah.
Yeah, I think we only have one left, right? When you say absent member, you mean everybody or just Shirley?
Just
Okay, yeah, we can do that.
the choice.
She only missed this one,
Yeah.
right? All right, okay.
That's the case even if she wasn't here to hear the presentation.
Yes, yes. So this is, we're on page 103. This is proposal number 3, is that correct?
107.
Okay.
Page 107.
Oh, 107, I'm sorry. Proposal number 3,
107.
yes, page 107. Senior Assembly Member Young. The proposal is skilled nursing facilities, end-of-life privacy. Go ahead.
And then first of all, I want to apologize, keeping you waiting. We have a unique situation in our committee. There are only 5 of us, so a quorum is 4, and only one person can leave at a time and still have a quorum. So it's creating quite a problem, but that is why it takes so long. This proposal is a proposal that's been near and dear to my heart for about 3 years. And basically what it stems from is a friend of mine was in a nursing home, was there for over a year. And of course, there's 2 beds in a nursing home. She became rather close friends with the lady that was in the next bed. There came a time, of course, that my friend was sent to the hospital with kidney failure. The doctor told us that there was nothing we could do. Her age at 84, dialysis was not an option, and that we could just make her comfortable, which was fine. But she was released from the hospital and sent back to the nursing home to the same bed that she'd occupied for over a year. And my heart went out to Phyllis, her roommate. There was nothing we could do for Neva, but Phyllis had no choice. but to sit there and watch Neva die of kidney failure, which is a rather painful death. When we went back to visit Phyllis, less than a month later, Phyllis had passed away as well. There is no doubt in my mind that having to sit there and watch that did not do a great deal for her morale or her will to live. And that's why I did this proposal. I would want that what this does is tell managers of the nursing home that they must at least make available some privacy for the person at the end of life. Now, it doesn't necessarily have to be a private room. Number one, there's a lot of small nursing homes that don't have private rooms. Number two, there are some people that would not want it, and they should have the option of not having to have it if they don't want it. But at least the manager or the owner of the nursing home should be able to talk with the patient and the family and allow that person to have the privacy that they want at the end of their time, and allow for options. When my dad passed away, he was in a room that had 2 beds, but the home was aware that it was not going to be very long. So for a couple of days, they simply didn't fill the other bed. It's as simple as that. And that's what we want. This proposal would do is to ask the nursing homes to at least talk to the patient family and arrange for privacy if it's wanted.
When you talk about that person that you were dealing with, which is, I assume, was very dear to you, and I respect that, was there any possibilities that this person could have been transferred to a hospice?
She had been in the hospital. They transferred back.
Hospice.
A hospice would come into the nursing home, but she would have to either be in the hospital or a private
Okay,
hospice.
what I'm saying is that there are facilities where a person can no longer be taken care of by the medical profession. And I've had my uncle, I had my very dear friend, and they were put on a hospice because the medical profession said there's no more that we can do for this person. But nevertheless, the medical profession has people there that are addressing their needs while they're still with us. Now, I'm not sure whether you have that facility in this part of the country, but hospices are run by nonprofit organizations that provide these last-minute services, if I may, before this person goes to a better world.
And that
I'm just going to put this.
And possibly there would be, but we were not aware of it. And that's one of the things I'm talking about in this proposal. Had the manager of that nursing home told us she could be transferred to hospice, just to let her know, let the patient know there are options.
I kind of
That's
think that
precisely what I'm talking about.
I think that there was a misunderstanding, and maybe the people that were running that nursing home were more interested in getting that patient there for a long time, or as long as they lived, versus going to a nonprofit organization and serve this person dignity. Because what they do is they have a private room where the dear ones can, one at a time, they have a bed for them so they can be with them in and out, different members of the family and friends, so that that person is never alone in a private room.
Right.
And yet they provide medical services for as long as this person is breathing.
And I
don't know.
I am not aware of any in Sacramento. There may be, but that's precisely what this proposal is about. The person in the nursing home should have at least let us know that that was an option.
Well, like I say, this is not a hospital. It's a hospice. It's strictly for people that are terminal.
Right.
Nothing else can be done for them other than to keep them comfortable. And I don't know, like I say, I'm not familiar with the Sacramento area, but maybe that's, an option. I don't know. It's not a nursing home.
Yes, I'm somewhat familiar with the hospice program, and there are areas in California that do not have hospitals in hospice conditions, and so what I'm hearing is that this is a proposal that the nursing home has to provide privacy to the person who is dying, whether it's hospice or not hospice.
As an ombudsman, I'm familiar with patients or residents that are in that situation, and some even assisted living have a separate room, and hospice comes in. Some nursing homes may have a room, but not all of them do. But hospice does come in. We don't have, that I know of in Northern California, any hospice facilities. It's just hospice service that comes in.
Yeah, I think when I'm listening here, and I think it's the definition of a nursing facility and the definition of hospice, they are different, but sounded like Senior Assembly Member Young is suggesting that nursing facility should also have a part as hospice. Now, if that's the case, I think the proposal should be written as that way, because otherwise the funding or the laws to rule the nursing facility is different from ruling the hospice. I'm not saying cannot be a combination of them, but that would be something new. For instance, like I came from a small town, San Luis Obispo, and to start with, Santa Barbara, which is 90 miles away from us, has a hospice. And we send our patients down over there, or they send people up to San Luis Obispo. But now San Luis Obispo is a retirement community, sort of. So we have our own hospice. So we don't have that problem. Nursing home is nursing home. Hospice is hospice. But now it seems to me that you are trying to propose something that hospice will be a part of nursing facilities, then I think that probably need to tweak the proposal to be more specific on that, and that means also a little bit more research work needs to be done.
I am not asking the nursing home to provide hospice.
I know.
I am simply asking the nursing home to inform the patient of the things that are available to them. The things that are available to them may be a private room. It may be simply not filling the second bed. I don't want to demand the nursing. Believe me, the nursing homes have enough demands on them now that they don't need any more. I'm simply asking them to give the patient the option of having privacy in whatever way that privacy could be.
One of the things that we need to keep in mind is that the hospice is usually, as a rule, a nonprofit organization. And it's not a nursing home and it's not a hospital. They do provide services for them should the person responsible for the legal dealings of this person that is sickly would be allowed to go there. Now, I'll give you my example. My mother was terminally ill and my sister was caring for her. And she had a great relationship with her doctor, and what she did, she called the doctor just prior to her passing, and when he showed up, he said, "Move your mother to a hospice right now." And 2 hours later, she passed on. Not in the home, in the hospice. But like I say, it's a private, non-profit organization. Thank you.
Assuming we're talking here about an older person who's on Medicare, hospice isn't a place. Hospice is a level of care that is paid for 100% by Medicare Part A. It can occur in a center that is devoted only to providing that kind of care. More often than not nowadays, Medicare pays for hospice care in the person's residence, wherever that may be. So what I'm seeing in this proposal is a person whose residence has become the nursing home, and they are now qualified for end-of-life care. Of course, according to Medicare standards, that would have started long before the last 5 days, would have started months before that. But the gist of this isn't really even if the person is receiving official Medicare-supported hospice care, but simply the provision of some privacy during the last few days of their life. Many times that is correlated with them receiving Medicare paid for hospice care. But hospice is the type of care, and as he pointed out, Luis pointed out, in some areas that there are centers where that's all they do. But more and more Medicare is providing that in the residence, wherever that may be for the person. So this is really not a hospice-related proposal. It's a privacy during the last few days of life request, in my opinion.
I agree.
Yeah, nursing home, lots of people line up to go to the nursing home. And if a patient is only have less than 5 days to live and needs privacy with their family together, really nursing home is not a place to be with. And I know lots of people in that kind of a condition those patients sent out of the nursing home to go to so-called halfway homes. In other words, nursing home is not a place for that kind of a patient. So that's why I think one of our colleagues, Lois, here was saying that means that is the hospice, the whole concept of a hospice is taking care of families and let the patients die in peace and in a warm situation. So I think nursing home is not really definitely for this kind of purpose.
Okay, we've kind of run out of time, so can I have a motion to accept this proposal?
So moved.
Second?
I second.
Okay, vote?
Okay, AP 3, Councilmember Tom,
Yes.
Assemblymember Lowe,
No.
Assemblymember Day, Assemblymember Ginsburg, Assemblymember Gould,
Yes.
Assemblymember Kagan,
Yes.
Assemblymember Crone, Assemblymember Monke,
No.
Assemblymember Payne, Assemblymember Petty,
Yes.
Assemblymember Placencia,
Yes.
Assemblymember Koch, Assemblymember Taylor, Assemblymember Reed, and Assemblymember Wilson. Yes.
Okay, so,
Did you want to hold it for our missing?
yeah, we'll hold it. But right now, I think we have, what, 6 to 2 for approval? 5 to 2 for approval?
We got 8.
Yeah,
8, 2. Oh,
yeah.
We got 8, 6, 2.
no.
So we're just going to hold for
17.
Shirley, but right now, it's 6 to 2 in our past, actually, so.
17.
Thank you.
Sorry, Lola.
Who's next?
Assemblymember Mitchell.
Mitchell. Is that the last one? No? All right, we are on page 131. AP proposal number 28, Senior Assembly Member Mitchell. This is called Marked Senior Crosswalk.
Good afternoon, ladies and gentlemen. It's my pleasure to be before you in my chambers that we normally hold the Health Committee meetings. And so I'm very familiar with these chambers. But let me start by telling you this measure was a measure that came before us about 5 years ago. I wasn't terribly interested in it at that time, but when it happens in your own backyard, it kind of draws your attention. The only thing different is Ed then didn't have the personal things where people come to eat, where individuals come to their to have their lunch their hot meal during the day. Well, that happened to us. There were a couple of people who it happened to at the James Wood Community Center. So I took Ed's old bill with his permission and rewrote it to include the senior nutritional sites. And so that's why this bill is here today. And I would just encourage you to look at the bill, to look at it with an open mind. I had a person run up to me last night, which kind of surprised me, from one of the counties up north, and she said, "Mr. Mitchell, are you Mr. Mitchell?" She had heard my name. I was given an award last night, and I said, "Yes, ma'am." She said, "Well, I want to tell you that my county, my AAA, and my county senior club, your bill is one of the 10. She said, "We reviewed all 63 proposals, and your bill is one of the top 10 that we selected to support." I said, "Well, I'm thankful for that, and I will tell the committee when I testify before them tomorrow." So anyhow, that's what the bill does. That's what it's aimed at doing, and I hope I can get your support on it. I'm prepared to ask any questions. I'm trying to do it as fast as I can, simply because we, like you, are caught up with the committee shortages. Our committee members are everywhere, and I'm trying to get back so somebody else can be released to go somewhere.
Go ahead, you're first. You're second. Great idea. How do you plan to go about marking these? What would be the way that you would mark these crosswalks?
Well, actually, we have several different suggestions in the full proposal, based upon what has been done in Canada, what has been done in other states of the Union, and we also have some suggestions about they're using the federal stimulus money, since this was one of the requirements of the stimulus package, that they use some stimulus dollars. So there's some federal money laying around waiting for communities to ask for under this specified.
Would you mark like blue crosswalks? I mean, I just kind of have I'd like an idea. I think, like I said, I think it's a great idea, but I'd like to know how you'd go about implementing it.
Assemblywoman Gould, I'm not going to tell cities how to do it. I would leave it to their genius, because I think each city might have something else going on in its mind, and I would like them to come up with what they think would be the most noticeable thing to occur in their city.
Okay, thank you. Assemblyman Petty?
I like the idea of anything that increases the safety of locomotion for seniors, because none of us move as well as we did when we were 20. However, I will disagree with what you just said about leaving it up to each locality to come up with it. I think there should be, if this happens, there should be a standard sign, just like we have a standard sign for children at play and other things that we want the motoring public to be aware of. So I think there should be a standardized, if this happens, sign put at crosswalks alerting motorists that there may be seniors waiting their turn to cross the street. I have a photo of one that is purely in jest, but the caption is "Senior Crossing," and it's one of the yellow signs like you see at things for children to play, except it shows somebody going downhill in a wheelchair. But I think there needs to be a standard one, rather, as opposed to leaving it be whatever each city decides.
Unfortunately, let me, if I could, just respond to that. And the only thing I've had, and I've had several cities who have submitted their artwork and design. Some of these cities have already started this, and they have done it with taste. We have 4 or 5 right in our PSA 25 who've already done them. They're all different, but they're done with taste. I wouldn't dare go in those cities and say to their city manager, hey, wait a minute now, okay.
He's next.
Okay.
Go ahead.
Yes, sir.
Assemblyman, I am familiar with the Disabilities Act in dealing with signage and different letterings and whatever regarding that issue about disability. I concur with my fellow assemblyman that first of all, there should be a standard. And before I think we can implement this idea, which I think is great, I think that we need to go to the state level and come up with a uniformity in dealing with the signage. Now, in the city of San Diego, we have signs for crosswalking where you push a button and it beeps for people hearing impaired. And, we have, everybody has different ideas, but those things work. But if you're going to be implementing this signage for all the seniors throughout the state where they have these kitchens facilities, maybe we should start thinking about a state standard, so that way you can probably be more effective in dealing with this particular issue, which I think obviously very, very, very good idea. But we got to have uniformity, because if I go from here to Eureka and they have a sign and I am from San Diego, how am I going to know and decipher all these different cities?
Well, I just tell you, just like it is, and I'm being honest.
Well, the idea is great. Don't get me wrong, but we have like the disability thing is nationwide. I'm familiar with this legislation because I was a code enforcement officer for 30 years, and it works.
And I was a legislative analyst.
And it took 30 years to implement, by the way.
We have time for one more question.
Yeah, I wish Sally Wick would be here. Sally Wick was the chair for many years. And she probably would said, make it general and do not go into the details and fight for it. So, and I think the proposal is very straightforward. Just said establish a marked senior crosswalks, conveniently located close to the facilities, across the street or highway. So I thought we're just going to leave it at that. And whether standardized or not, maybe could be another proposal and carry on in details. Maybe 3 or 4 people have the same idea, can write a proposal for next year. So I would support this idea, just close to the facility, which in fact, again, San Luis Obispo, we do have that. But I'm glad someone...
All right. Thank you very much. Can I get a motion to accept the proposal?
I would like to move.
Okay, second. Ready for the vote?
Assemblymember Tom?
Yes.
Assemblymember Bell?
Yes.
Assemblymember Day? Assemblymember Ginsburg? Assemblymember Gould?
Yes.
Did I hear a yes?
Yes.
Assemblymember Kagan?
Yes.
Assemblymember Crowe? Assemblymember Monquet?
Yes.
Assemblymember Payne? Assemblymember Petty?
Yes.
Assemblymember Placencia? Yes. Assemblymember Pope? Assemblymember Taylor?
Yes.
Assemblymember Wick? Assemblymember Wilson? Yes.
All right, thank you.
Thank you.
Your proposal is passed, but we're waiting for one absentee, okay? Thank you. Two. Oh, that's right. Thank you. Waiting for two. Who's next on our,
We have AP 13 and AP 14.
14.
Aaron is AP 13.
Oh, 13.
who was here first?
Doesn't matter. 13 or 14, let them pick.
Doesn't matter, whoever was here first. Come on up. Which number are you?
I put my glasses on, look at my 14.
14.
Right.
All right, this is on page 123, Senior Assembly Proposal Number 14, to be introduced by Senior Assembly Member Schwartz. Excuse me.
Sorry.
The topic is senior training. Did we just do a senior training? Okay.
Yes, it is. All right. Pardon me if I cough a little bit. I'm trying to get rid of a cold or whatever it is. This particular proposal, the idea of it came from a fact of attending a meeting at a local organization I belong to, in which some people were decrying the fact that they had lost their money in their 401k, their life savings because of the stock market crash or whatever, or their poor investments, and they were moaning, what are they going to do? They have to go back to school to relearn or learn something new so they can get back in the workforce. And because I'm familiar with the work of the community colleges in the state of California, I thought it would be a wonderful opportunity for them to show what they can do by training or retraining in an accelerated program seniors, or I'll change the word, to older adults who are in need of the retraining to go back into the workforce. I met with the people at the Saddleback College, Community College District, which is where I live, and they encompass two schools. One is the Saddleback College and the other one is the Irvine Valley College. They're about 10 to 12 miles apart. They have the same administration with different faculties. I asked them what they can do about retraining, and they introduced me to what they call their Emeritus Institute program, which is a program of delivering service on an unaccredited basis to the community rather than having the community come to the college. For seniors, that's a wonderful idea. Saddleback College has 29 at the present time and 31 beginning next month off-site campuses which they deliver these services of re-educating or educating to the seniors who need it. And it's at their home or at their location of their local church, their local assembly hall, the local library, the local bank that has a meeting room. And it saves the seniors the cost, the expense, and the problems of traveling to a college which may be 10, 15, 20 miles away, whereby the college in itself needs one professor or one instructor to go to that location where you have 40, 35, 55 students willing to learn. That's what brought this particular proposal apart. I've also found out that it's at no cost to the state or to the college to do this particular type of thing. As an aside, as a statistic, Saddleback College District has 13,000 students in their Emeritus Institute program. Some of the students pay a fee if they're in particularly physical therapy and they need additional physical therapy courses. Some of them take courses in high technology, graphic arts, what have you. Saddleback College in itself is beginning next year. They have received approval and it's starting a Department of Gerontology to go along with their Department of Nursing. All this is of concerns and help to seniors. And it is impossible to get an answer from the State Department of Instruction. They say present it as a finished article and we'll discuss it then. Meanwhile, this is new to a lot of schools around the state. I don't know if every community college has the facilities or faculty go and deliver the service, or there may be too many scattered around the state, within a county or within a region to do it. But the great majority of our senior residents, I'm using the ones, are older adults who have to get back in the workforce, have need for the refreshers that can be done through a community college district. And it being an unaccredited course, there's no charge to them. That's what the community college is there for. A community college is a two-tier system. One for those students who are going to prepare themselves for the 4-year school so they can get a degree, and the other ones who are there to continue their re-education. And for the older adults who need it, this is a very important part of being re-educated, because unfortunately their retirement age, the golden years, has been tarnished. And that's it. Okay?
Thank you.
Any questions? I'll be willing to answer if I can.
Is there any first? Go ahead.
Yes, sir.
I can't tell you how enthusiastic I am about this. Before I left Monterey at our last AAA council meeting, when it was time for the CSL report, of course, I hadn't come to a meeting yet, so I had nothing to report except for a little bit of preparation that I was doing for this week, and I identified this particular proposal as the one out of our committee here that I was most enthusiastic about. And the reason for it, my enthusiasm, is not just because of the assistance it would provide to people who are currently past the normal retirement age and going through the trials and tribulations that you pointed out, but I think this is a proposal that helps us focus in addition on the boomer seniors, because not only are they in the same boat in many cases with regard to losing their jobs, losing their 401ks and all that, but consistent with what Lynn Dauscher told us about volunteerism being one of the two major wigs, as she put it, in the Department of Aging after transportation, being the instructors at the colleges for these different kinds of retraining classes would tap the skills, expertise, and training of boomer seniors, provide them with something to do. The whole idea is going to be how are we going to prepare for and use boomer seniors as we get ready for the millions and millions of us that are turning into seniors needing these services. And I think this is just an outstanding idea for providing a mechanism for boomer seniors to help other seniors. And seniors helping seniors is a theme that we're all probably familiar with, and I think this is just a great way to do that. So thank you for bringing it.
Thank you very much.
Great. I think this is a great proposal.
Thank you.
More and more seniors needs to be retooled for a new, I call them seniors. Actually, they are between 50 to 64. And
older adults.
Yeah.
Older adults.
That's, and of course, 64 and above, that they have a better probably situation. But highlighting 50 and 64 because they have healthcare insurance problem and they need to find another job, so they need to be re-educated. But other than that, the boomers coming out already, it's already on the market. Some of them immediately knew that they have to be retooled. And lots of community colleges already started that. But Cal Poly San Luis Obispo just started 2 years ago. And every time we were so angry, we keep on knocking on their door. But I think if there's legislation said every colleges, if they want public money, they have to provide that. That would be great. So I'm really supportive of that.
Thank you.
Go ahead.
For a person who just received his teaching credential a year and a half ago, I'm fully agree with you, but I think we must not forget the idea of adult education and the ROP programs and all the many other programs that are available to us as seniors. There's lots of fine programs around. Good proposal on this one, though.
Well, just one little aside.
1 minute.
I take one course in the emeritus program. It just so happened that the professor and I go back about 50 years. I had known him many years ago during my time in practice and his time in practice. I'm a CPA and he was a banker. And then he went into consulting. And I introduced him to a man who became his partner. And they became very successful. Now he retired and is now teaching investment banking and all the effects of geopolitical economics around the world. So I go to the class and he and I play yo-yo with the class, raising questions back and forth to educate the class on economics, finance, etc. It's a wonderful experience. They learn a lot and I learn a lot more.
Okay, we have time for one more question.
Beg pardon?
I do agree with your idea. However, like I say, I have seen the older generation, people that have lost their jobs because of one thing or another that melt down the economy and what have you, and the lack of skills to go into the workforce where there are higher demands for services. You know, it used to be when a person can type 3 letters or an hour. Now they type 300 letters in a minute, you know, with all this equipment that they have now. And it's just like the Industrial Revolution kind of thing. Now that is electronic revolution. But, and I've seen many seniors now, and not just necessarily say over the retirement age, but even prior to retirement age, where they mentioned that the health services are not provided because most of these people will work at the Walmart, the Costco's, and places of that nature that don't provide any services. So they need to work. So the only thing that I wanted to ask you that I probably misunderstood or didn't quite get, you say that you have volunteers, teachers that will go at the site at no charge?
I say there are teachers there. They are not tenured professors. They are engaged by the school, the college district, to teach a course. They all have a certain minimum salary.
Are these the new teachers that need to teach for a semester without pay, and then they are able to get a credential and maybe get a position, and further down the road they will get a tenure?
Now, on that, sir, I do not know what each individual professor or instructor gets or doesn't get. I didn't think it was my business to pry into that. I know that it's practically, I know at Saddleback and at Irvine, it's at a minimum amount, if anything. I know most basically they just pick up their expenses of transportation or supplies in the classroom or whatever.
Well, you know, the reason I mentioned the financial end of it is because San Diego State has just asked about 20,000 students that there won't be any place for them because they have a lot of money that has gone out that not coming in. And who is going to be, I mean, you know, how are we going to fund this thing?
According to the president of the Saddleback College District and the chancellor and their chief financial officer, these programs do not cost the college and therefore the state any money. There is no, the way it works out, their funding overall to cover their administrative expenses and so forth more than encompasses. If they reach their capital in regard to the number of students that they can teach, then they have to come back to the state legislature and to the Department of Instruction to increase that level or maximum amount of students.
Okay,
But the funding is the issue.
Yeah, I need to cut you off here, and we got one last person. We have a little time, so we're letting her ask your question.
Arthur Saranazzo, he can talk away. He's a friend of mine.
I'm an emeritus professor from a community college, so I can speak about community colleges. And I would make a recommendation, or I'd like to make an amendment to your proposal, that instead of saying, it's on line 47, community college districts in the state of California replicate the Saddleback College Emeritus Institute, I would rather have you say replicate, for example, the Saddleback Community Emeritus Institute, because many community colleges offer the kind of program, as do Cal State University and the University of California.
She needs water.
But they do not deliver. One of the unique parts of the Saddleback is the delivery of services to the community.
That's why I said, such as the Saddleback, because you're going to have a war from other community colleges if you try
I
to.
gratefully accept your amendment.
Okay, so are we asking to amend this?
I am.
You are. I don't know what I'm supposed to do. All right. Any second to that motion? Second. Okay, so we will, Eric?
Yeah, I just want clarification on what this amendment's going to be before we take a vote on whether or not to accept it. So the actual substantive part of this proposal is on, I have page 129, it's the first resolved clause.
Yes, right.
So where we say that we're hereby proposes that the community college districts in the state of California replicate, and you want to say, comma, for example, the
Exactly.
Okay, the Saddleback College Emeritus Institutes program. Okay, let's see. So right now we're saying that they're replicating that program. We just want to say that as an example. Let's see. Proposes that.
After the word replicate, you could put, for example, the Saddleback College Emeritus Institute programs. Does that make sense?
I understand we want to use that as an example, but the verb we have here is that we're replicating something, and then...
Can I make a suggestion?
Yes, please.
Proposes that the community college districts in the state of California provide programs in the training or retraining of older adults and in the delivery of these services to the students, such as the College Emeritus Institute at Saddleback College.
That's acceptable.
That addresses what I was
Okay, that's
getting stuck
fine.
on. Okay. Yep.
Okay.
All right. So I think we've clarified what the amendment would be.
Right.
So now you've already
need
got
to
a
make-
motion and a second to take a vote on those amendments to adopt them.
Okay, can I get a motion to, so move second? Anyone second? Okay, so this is for the amendment. So it's been moved and second that we will add those, whatever the words were, to the amendment for yours. Can I call for the vote now? Yes.
Yes.
Yes. Assemblymember Kagan?
Yes.
Assemblymember Crone?
You.
I
Vote.
didn't hear the whole thing.
That's
so
okay.
I'm not sure.
It's all right.
Okay. Yes.
Thank you, Charlie.
Wonke?
Yes.
Payne?
Yes.
Petty?
Yes.
Placencia? Yes. Polk? Taylor? Wick? Wilson?
Yes.
Taylor's here.
Oh, Taylor is here.
Taylor's here.
Yes. Yes.
All right.
Member Taylor? Aye.
Aye.
I'd like to move we accept the motion as amended. The
So
proposal
second?
as amended, I'm sorry.
All right, well,
Second.
the proposed, Senior Assembly Member Schwartz, your proposal has been, it's 11 to, right?
No, we haven't voted
Oh,
on
the
it.
amendment.
We haven't voted on it.
Oh, now we have to re-vote again? All right,
Propose it with the amendment.
okay. I'm learning, sorry.
That's all right. I'm learning
All
too.
right,
Okay,
someone
roll
want to
call.
make a motion? We want to go through a roll call again?
I
Okay,
move we accept the proposal as amended.
I second.
all right. We're going to do it again, okay. My answer is yes.
Yes.
Tom Lowe?
Yes.
Roselia School?
Yes.
Kagan?
Yes.
Crone?
Say yes.
Wonke?
Yes.
Payne?
Yes.
We have had some fun.
Petty?
Yes.
Placencia? Yes. Polk? Taylor? Wick? Oh, Taylor?
Yes.
Wick?
Sorry.
And Wilson?
Yes.
All right. Thank you very much for your proposal. It's passed as amended.
Thank you.
Thank you.
Shashi.
I just wanted to make mention that Modesto Junior College is doing that, and it's working out very well.
I thank you all very, very much.
Thank you.
I can't say how much I appreciate it.
And now, our last one.
Madam Chair, before we move on over here,
Yes,
One more thing I
sir.
just want to point out. So earlier, when I was saying about leaving the rolls open until the absent members came back, well,
Right.
we've got the absent members here, which is a good thing. But I actually have other instructions here that are a little more specific on that point.
Okay.
And basically, it says with respect to holding the rolls open, the author can request that the rolls be held open, or any member of this committee can request that they be
okay.
held open. In this case, none of the authors specifically requested that the rolls be held open. So at this point, we could see if a committee member feels strongly about keeping the rolls open until we adjourn today to take a vote on the 3 bills that or proposals that haven't been finalized yet, or we can just accept those votes that were taken with people who were here as the final vote and move forward from there. So it's kind of up to you how you want to do that.
Should we finish?
You can wait. You can do whatever you want to do. I just want to clarify that point.
Why don't we finish?
Sure.
Because we only have one to go, and we've
Sure.
got time.
And just
so-
finish it up at the end then.
Yeah.
Okay.
All right. Senior Assembly Member Sarin, thank you for waiting. We are on page 115. This is proposal number 13. It's going to be introduced by Senior Assembly Member Sarin. And the title is Supplemental Nutrition Assistance Program.
First, let me clarify 2 major points of this proposal. One is, we're all familiar with the food stamp program. Okay, the food stamp program is now being, in effect, revised generally to include a debit card arrangement, which is called a SNAP card. Okay. There are approximately 30 million persons on food stamps or SNAP eligibility. One of the prohibitions of that card or the food stamp program has to do with hot food items. Just like it sounds like it's booze or cigarettes, but it's not. Okay. In any event, that precludes the citizen, the needy person on that program, from obtaining hot meals unless approved. Okay. There are only 13 out of 700 senior centers that have that approval at this point. Why don't they have that approval? Generally, it's primarily they're not informed about the program and the fact that they can obtain such approval. Okay, this prohibits the senior from 2 things. He can get groceries, but is he able to cook? Is he able to maneuver around a kitchen? Is he unable to select the foods and prepare them? Generally, yes, mostly they can do this at great cost to themselves. Okay, or they need an attendant or they need someone to do it for them. The other part of that is it confines the senior to his home or his residence. It doesn't give him the opportunity to get out and procure a hot meal, okay, unless he wants to go to McDonald's, which is, not a nutrition-approved situation. Seniors need that nutrition, but they also need something else. They need social contact. They need exposure with other seniors in a senior center or some such facility that they lack because of a lack of interaction at the senior center that does not have the approval for hot meals and so on. What do we do about that? Well, we encourage the government, meaning the state in this case, as a agency, to institute and to pursue getting approval of the congregate meal facilities and to get the SNAP card approval authorization, okay, and process that and get it more action, if you will, in that arena for the seniors. Now, we know the benefits of social interaction. We've seen it, when you go to a senior facility, you have other opportunities to mingle, to participate, to do the things you can't do as homebound, okay? So what we're now looking at is encouraging that use, getting the SNAP card out in the open. And what does it do? Okay. At first, it's going to increase or improve the underuse of senior center facilities because of now the availability and the reduction of the stigma of using food stamps at a grocery store and having a debit card, which is less conspicuous, if you will, when you're ordering your meals. The argument against it, okay? The argument I've heard is, well, seniors can go to a senior center without a SNAP card, and if they don't have any money, they don't have to pay anyway. Well, I'm a senior. I have a great deal of pride, and I think many seniors have that degree of pride. If there's a recommended donation of $3, I'm going to pay the $3. I'm going to be more willing to pay if I'm using it like a debit card, because our society has been brain trained that as long as you have a piece of plastic, okay, you can use that at will, and it's not a reach in your pocket and see if you have the money situation. Okay, the average, call it the average intake of a family is about $200 a month on the food stamp or SNAP program. Their income is about $600 and some dollars. And you can see the relationship there, what it would provide. If a senior went to the senior center every weekday, which is what they're usually open, for 20 days a month, he's spending $60 out of his $200. Okay, and he's getting a hot meal. The flip side to that is, where you have Meals on Wheels, you also have the opportunity of using your SNAP card to pay for your Meals on Wheels, okay, for those that cannot get out and are physically or mentally incapable, but they will get a hot, nourishing meal as opposed to reaching in for a can of chili and heating it up, okay? They're going to get something nutritious, because all of these centers have to have approved nutrition menus. It's not like you can go in there and get a hamburger, okay? They have to have the proper diet information and capability to offer these meals, which means that the senior is going to benefit in many directions. He's going to benefit socially, he's going to benefit from a nutrition standpoint, and he's going to have other opportunities for other activities by going to the senior center. Now, the SNAP card is being used now in a great many places. We're saying that the government, our government should, or our state, should go out and say, look, okay, we want to get you approved as a nutritional facility. We want to approve you as a SNAP card user facility, and we want to make available these benefits. Okay. And that, in essence, is what we're trying to talk about. We also have a new generation coming in, the senior boomers, and they're used to that kind of action. You try and hand food stamps to an incoming boomer, and I think he'll, okay. But if he has a debit card, okay, which we're all ultimately familiar with, I think they're inclined to use it. And again, I want to stress the interaction that the seniors need and the nutritional needs of getting this plan and this program into action. Yeah. Any questions?
Well, I have a question. Okay. In reading this, the only thing that I really question is when you, on page 116, in which you say the state of California or whoever should contact all senior centers in the state to decide whether they have a meals program. And I'm thinking as I'm reading this that I am not sure anybody wants to go do all the contacting, because usually it's the reverse, that we have a program, people would contact you. So it's just a question in my mind that are you expecting that when the government signs this that there will be a department they create to go to all these senior centers to ask?
Okay. Of course, there already is a department that administers this food program. Mm-hmm. And they, in effect, could accomplish this simply by a letter. Okay, there are 700 senior centers, incidentally, in California, which means there's an ultimate geographical, widespread availability to do this. How many now have approved cooking facilities? Mm-hmm. That will be ascertained, of course. And how many will be encouraged to have cooking facilities? Right now, we're looking very hard, that is, I'm on a committee at AIS, we're looking very hard at the future of senior centers. And one of those aspects of the future is to have knowledge of and updated facilities to attract the new baby boomer seniors, such things as a cyber cafe where they can go in and, and you can use this. I have personally delivered Meals on Wheels with my daughter, and I can assure you that the senior coming to the door and having that, even that bit of social contact where they're confined physically or mentally is invaluable.
Okay. Thank you. Assemblymember Lowell?
Yes. You have to excuse me, I'm naive on the SNAP card, but I would like to ask, because you're trying to have SNAP card come to open, so that means right now the SNAP card is not open, like secrecy, that come to my mind immediately. And then the other thing is, right now the SNAP card is from county welfare office. Of course, it has to be trickled down from the state and down. I'm not going even to mention about federal, although your proposal did mention about the federal. But if it's county and it's a SNAP card, it's not so true. Each recipient's SNAP card amount is different because not everyone every month gets. Again, I'm naive. See, not everyone get $500. Some people get food stamp maybe $800, some maybe $300. So that how do you make sure the SNAP card will be counted correctly? Okay. Is that like a credit card, or sorry, not credit card, like a debit card or whatever you?
Yes.
I don't even use debit card.
First,
so in other words, you say you have $500 in the SNAP card. Every time they go through the line, buy the food, hot or cold or grocery, then they swipe the card, deduct certain amount. But how do you how do they do that? In which everyone would be different. It's too much work.
Let me describe that for you. Okay. First of all, that's established formula. The income of that household determines the amount that they get for the, quote, meal or food stamp program. In other words, there's a certain amount prescribed for the income level, the net income level. They also will deduct 30% from the net income, and there's a formula in place. Okay. Each family, of course, would vary, okay, on the amount of credit that would be stamped into the card. It's the same as if you went to an ATM machine. You have so many dollars in the bank, and you draw down against that. So it would vary. Secondly, how could they do this? Well, they do it all the time now in grocery stores or chains and so on, where they run your card through, your debit card, and there is equipment in place that would do that. Okay. The government, meaning our state, would also furnish the equipment. It's not a big deal equipment because it's an established technology where they could do that and deduct each time the amount of payment due on the SNAP card. And it would have a limit, just like your debit card, to the amount you were authorized under the program per month. Is that sort of explained for? Thank you.
As I understand, the reason for his proposal is to make sure that the individuals that do not have the cash on hand to go to these centers, they will not accept food stamps to get a hot meal. And should we do that, these individuals would be nourished according to the minimum standards established by the health department or whoever does that. And by doing so, these individuals will have a healthier diet and less susceptible to disease. Am I correct?
Say again, Louis. They would be
less susceptible to disease should they have a better nutrition program.
Of course. Yes, and that's one of the things that's lacking.
Thank you.
In, yes.
Okay. Just a quick question. How will they use this SNAP card in a senior center? Will there be a machine put there for this SNAP card for them to insert this card in a machine just like a debit card?
Correct.
Okay, another question. How different would this be from the ones that's receiving general relief from a SNAP card for seniors? Because there are cards out there already for mothers, on welfare. They go and they shop and they swipe the card, just like a regular debit card. Will this be the same type of card that senior will be getting? Because the card's out there already, whether you call it a swipe card or what. There are cards out there already
I would
for
assume
welfare
that,
recipients that they're getting general relief, and mothers with children. They have these cards already. They go to Vaughn's Market, they go to Raff Market, they go to all the markets and shop with these cards. So my thing, will this card be any different?
I would expect it to be essentially the same. Okay, it would be the same type of card. And what you're speaking of now is where you go to a grocery store and you can get, lettuce and bread and so on.
Right.
The purpose of this is to provide a hot meal, which is prohibited at this point. Hot food items are not covered by the other card. It's prohibited under the food stamp program. This would now allow the facility to be approved specifically for hot meals.
Right. And you also spoke of the fact about charge, because really there's no charge. It's a suggested donation.
Right.
Any senior that walked into a senior center, I worked for the senior center for 13 years, any senior that walk into a senior center without money, they can eat.
Yes.
Yeah, there's no demand to make them pay. There's a suggested donation. They have already all suggested that, because they used to put that box out front to intimidate seniors. So they asked them to move that box back, because seniors walk in and they see a suggested donation, and without the money, they go away hungry. So you simply can't make them pay. So I'm just wondering if this card would be a different...
Well, it would be different in that it removes the stigma, if you will, of having to put money in the box if you don't have it. You have a card that's a debit card that allows you to pay if you so choose. You do not have to pay at a senior center, of course. It's a donation.
Okay.
But the pride of the individuals, and I'm going to emphasize this point, the boomer generation seniors and others very often will not go there if they don't have the money, because they don't want the stigma of being in line and getting a free meal while their Pontiac is parked outside.
Well, I'm going to agree with you, because I'm a boomer, and I would not go in there and accept food
A free
like
meal,
that.
right.
Okay, one of the things is we had set a time limit, but we do have some time. We have like 4 questions left. So I'm going to extend this at least 5 more minutes. Assemblymember Petty is next. We'll go
Okay.
to you.
You said that recipients of SNAP cards are currently prohibited from using them to obtain hot meals?
Hot food items.
Hot food items. Well then, but you've said that there are 39 communal dining facilities and 17 meal delivery services that do provide that using the SNAP card.
And they are approved to do that.
But I thought you said that it's against the law. So I'm
Not against the law, just against the current regulations. If you get an approved dining facility that has the nourishment content that's approved, you can use that card, and they've only progressed a very few of those through the process of the system, whereas this is encouraging the content be made known to all of the senior centers and get that approval.
Yeah, I mean, if it's a program that's not being publicized by either the state or the county department that's responsible adequately enough, then obviously they need a kick in the pants so that centers providing the food will take the steps you're suggesting. I'm just not as convinced as some of my colleagues are that just because somebody's a boomer, they wouldn't go in there and save the money on their SNAP card for when they have to go to Safeway and get the meal for free, which they have the right to do already.
It's sort of
I'm not sure it's going to increase the number of hot meals. It may increase the revenue that the senior center gets, but I'm not sure. I'm just not sure.
Okay. I'm not either. Who is? Okay. Well, I'm saying, though, however, that when that person goes in there and he has the availability of the SNAP card and the debit card concept, he's going to use it. very few people will go to a senior center if they cannot have auxiliary benefits of going, such as companionship, such as other facilities.
Really, all this is neither here nor there. The gist of your proposal is that we are requesting the state to advise those programs that aren't in the SNAP program that they could be, and certainly I think there's nothing wrong with saying, hey, let them know about it, and then we see what happens.
Basically, if I'm not mistaken, is that there will be another possible amenity that the recipients of these kitchens would be able to go there, because now they have a SNAP card, and the whoever provides these machines that you snap and get charged and deducted from your account, is that basically that's what the main concept is, that somebody provides those machines, so that, and also the concept of providing the proper diet for these folks that are being fed. And basically, that's what this amendment is about, or rather this proposal, am I correct?
It's to facilitate that, yes.
Thank you.
And to facilitate the interaction and the social contact, and to improve the use of senior facilities, which are senior center facilities, that are underutilized at the present time.
Thank you.
So you're trying to push all of this in a direction.
Assemblymember.
I think this is a great idea because of the credit card concept and the fact that seniors coming to the centers, they don't always they can't find their food stamps, or they can't find this or that, and they've got a card in their hand. I think it's a great idea. However, what about I know that in Northern California there are many areas that don't have senior centers available to seniors. Will this apply also to the Meals on Wheels
Yes, it
drivers?
will. Yes, it will.
Okay.
Yes.
All right.
And yes, there are, I don't know how many are in we do have 700 facilities in the state.
Well, I also like the fact that you've got public and private, because a small business that would not necessarily serve a senior with a credit card, they might.
Okay, well, quick question. So a family probably will ask for more than one SNAP card, because the husband probably can go there, eat, and the wife and the kids. So how many SNAP cards each family would have?
Well, there would only be one authorized, to my knowledge, SNAP card, and that is, it's got an amount of money on it. How it's used among the members of the family could be interchangeable, but I don't think they would issue more than one. It would be...
Will someone make a motion to accept the proposal? Second? All right. Voting. Ready to vote. Yes.
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 Thank you very much, Assemblymember Sarin.
Thank you all
It's
for
been
the
approved
consideration.
and passed. Thank you. All right. Well, first of all, I want to thank everyone for putting up with me today. I'm learning, and it was great. I'd like to thank our staff members. Oh, before we do, I will get back to our voting on absentee. I wrote it down. I really want to thank Eric for raising his hand when he needed to, Nancy for at least noting when it's time for me to give it up. But, I looked at the time, we had some time, and I didn't really want to interrupt because some of the questions I think were needed. Thanking to our messengers, Michael and Marcia. So now we're going to get to the business where we had 3 proposals, I believe, that we needed, we decided 4? Yeah. That several of you were out, so...
No, sorry, you're right,
3, right, okay. So the question before all of you is, do we want to revote, for them to vote for those that they weren't here for? We actually had enough of a quorum to pass it, right?
Well, you had
Or-
a quorum, you could take the vote, but we just held the rolls, sorry.
Oh.
You had a quorum so that we could take the vote, but we just held the rolls open. But I subsequently found out that the rolls could be held open if the author requested it or if a committee member requested it. The authors didn't request it, a committee member didn't either, so we didn't technically have to hold those rolls open.
Okay.
So at this point, though, we can go ahead, since we still have them in our possession, we can go ahead and take a vote, and the absentees can either abstain if they don't feel comfortable voting on something they didn't hear, or they can vote aye or no, however they wish. So if you want to do that, we can do that, or we can just close them out.
We have a choice here, and that's what we're talking about. We could either re-vote with all the people that are here.
No, we don't have to re-vote. We can
Oh.
just take the vote of the absentees.
Oh, okay.
People were not here, like Sharon.
Like-
and
Was there some that were on consent calendar without doing that?
Yes.
Because that would put them in jeopardy, I would think.
Well, if somebody voted no, yeah.
Yeah, knock them off of the consent calendar.
Question, if everybody had been here and one or more of us abstained, but everybody else voted aye?
Yes.
Would it go on consent?
Yeah, the instructions here say that an abstaining vote does not defeat being put on the consent calendar if everybody else votes aye. Yeah. But if somebody votes no, that's another story. It wouldn't go on the consent calendar.
Yeah, we had 2, I believe, that had no dissent votes
Let's
on them.
see.
There's 2
I
of
think
them, right?
if one no vote still is a consent item.
No, no.
only no-
It has to be
no.
unanimous.
Heard yesterday from yesterday afternoon, the JRC was here. I think they said one out of the rest of them.
Well, in
it's
the
a no.
rules that I read this morning, basically, it does not go into the consent if there are any dissenting votes.
Yeah, my rules say only proposals which have the unanimous vote, parentheses, no dissenting vote of the committee and have not been amended may be placed on the consent calendar. So it has to be unanimous.
So,
Yeah.
So I would think that the author isn't here to ask that it's on the consent, so I don't think we should go now and vote on those. Maybe the other one if it's not on consent, but.
how do the rest of you feel about that? I guess, do we need to do a motion or anything? I mean, just asking.
No, I think the vote can be final with respect to AP 9 and AP 28 because those would be consent calendar items at this
Okay.
point. The only one then is AP 3, which I have down as currently having 2 no votes and 6 aye votes. So there's 3 absentee members that need to vote on that, or they can abstain.
Okay.
Or we cannot take a vote at all. I mean, because there's enough here to pass it.
Yeah.
Shirley, you're
And
one of the ones that.
how
do you
about
feel?
AP 9 and AP 28? Because
Yeah, those are the first two I mentioned, and those 2 right now are set to be on the consent calendar. And I think that a valid point is brought up. The author didn't ask that the rolls be held open with respect to those 2. So if we took the vote now, if somebody voted no, that would jeopardize its
take them
consent
out of the
calendar
consent calendar.
status.
Yeah, which is not.
Is it my Madam Chairman?
Yes, ma'am.
Is it my understanding that a yes or no vote will have no effect on the outcome of the bill? Is that correct?
A yes vote would have no effect. It would still be on the consent calendar, but a no vote would then would take it off the consent calendar because then it would no longer be unanimous. And to be on the consent calendar, it has to be unanimous.
unanimously, yes.
So, and because of the lack of clarity of the rules that I was first looking at, we didn't advise the author at the time they were here testifying that they could request that the rolls be held open. We just held them open. So if we took a vote now and it was taken off the consent calendar, that might not be very fair to the author because they weren't here to request that the rolls be held open. As far as they were concerned, the rolls were closed once the vote was taken.
That's what I was
Because no committee member also either spoke up.
Well, Shirley started to say something.
No, I just was going to say that without having the presentation, I don't know if I would vote yes or no. If it can stand without a vote at this point, then I'd say let's leave it.
I agree.
So moved.
I don't have anything specific in front of me saying one way or another. I mean, this is a parliamentary decision that the chair can ultimately decide. If you want to take a vote, you can abstain, and that doesn't jeopardize its consent calendar status either. Or we can just determine that the roll is closed earlier and move on.
No,
Then, Madam Chairman,
yes.
I'll make a motion that we then close the,
Well, I was going to make an executive decision, and that was to close it too. So
moved.
So moved, okay. So we will not go...
With respect to all three?
Yes.
Okay.
All right.
So all of them, 2 were on AP 9 and AP 28 were consent calendar, and AP 3 was do pass with
Okay.
6-2.
Okay, great.
Thank you.
All right, thank you. Okay. The meeting tomorrow will be in the Senate chambers, which was supposed to be today, but I found out that it will be there tomorrow and at 1 o'clock. And what we're going to be looking at, for those who are new, I'm pretty sure we'll be looking at the Senate, the approved ones for our group from the Senate.
Their site.
Yeah, they're all their stuff. So, and again, I wish to thank all of you because it was an endeavor and an experience to go through this. So thank you very much. And we are adjourned. Yes.